Hello and welcome everyone to the Q&A with the experts. Today we are delighted to have with us the Head of Medical Oncology at the Northern Center for Cancer Care at the Freeman Hospital, United Kingdom, Dr. Mark Verrill. We are also pleased to have with us live Dr. Meteb Al Foheidi, who is the Associate Professor and Consultant Oncologist at National Guard Hospital, Jeddah. He's also the President of Saudi Oncology Society. Dr. Mark Verrill and Dr. Meteb Al Foheidi, thank you very much for taking your time out from your busy schedule and record this Q&A with experts. The topic of Q&A with expert is Monarch 2 OS interim analysis data disclosure at ESMO 2019. What do you think, like how mature the data is when we talk in terms of overall survival, what we have seen in terms of the disclosure? Dr. Foheidi first.
So in regard to the maturity of this clinical trial, actually the pre-planned interim analysis was pre-planned for 441 deaths, and this interim analysis was performed at 338 with a maturity of approximately 75%. And despite the interim analysis of the overall survival was tested at this maturity, I think the result is definitive because of high degree of maturity. So the result of overall survival, I think, is encouraging in this patient population.
Thank you, Dr. Foheidi. Dr. Verrill, over to you.
We've now seen several analyses of the Monarch 2 clinical study, and I think in the progression-free survival, we're not going to see any changes in medians and the hazard ratio because most patients are now beyond the median. And in fact, the more recent analysis presented earlier this year or late last year, that the medians didn't change at all. Overall survival, because it's a longer-term endpoint, is a little bit less mature, but there's still clear separation between the overall survival curves with an advantage from the addition of abemaciclib, which is both meaningful from the perspective of time approaching 9 months, and the hazard ratio, which is about 0.75 with a highly statistical p-value. So I think we do need longer follow-up for the overall survival, but progression-free survival isn't going to change at this point.
Thank you very much, Dr. Meteb Al Foheidi. Thank you very much, Dr. Mark Verrill, for this digital recording, and stay tuned for more Q&A with experts. Thank you so much, and goodbye for now.